Can you tell us a little bit more about what causes lung cancer to develop?
So lung cancer is a cancer for which in most people the cause is known. It's usually related to tobacco, to cigarette smoking. But it is important to realize that not all lung cancers are related to cigarette smoking. About 80 to 85% of all lung cancers are probably related to smoking or a smoking history. But some people will have never smoked, and in those people, there may be other reasons. Sometimes we just don't know why they have developed lung cancer. In others, it may be they've been exposed to other cancer-causing agents, either through their work, their occupation, through their environment, etc.
So if someone's a non-smoker or only smoked lightly for a short period of time, they might still be at a lower level of risk of developing lung cancer?
Yes, so people who've never smoked or smoked only a very, very small number of cigarettes in their lifetime are at a lower risk of lung cancer, that's for sure, but it's not a zero risk. So anybody, I think the important thing to remember is that anyone who has lungs, which is everyone, can get lung cancer. I think that the more people who are educated to know that lung cancer can occur in people who've never smoked is important, because it is something that people who are diagnosed, who've never smoked or very rarely smoked, do feel stigmatized about. And it's important to educate people that it is a disease that can affect everyone.
And in terms of our understanding of lung cancer, do we know if it is an inherited disease, or is someone more likely to develop lung cancer if they've had other family members who've been affected by it?
So generally speaking, there is not a direct genetic cause for lung cancer. Obviously people are looking at maybe very loose genetic connections, but it's not something which is passed down from generation to generation. Obviously, some people who may have been in a family environment who have been exposed to lots of cigarette smoke, or may through just their family members, they've started smoking as well, then they're at risk, but that's not a genetic risk. That's just a sort of environmental risk of the carcinogens from tobacco smoke.
And in terms of reducing risk of lung cancer, what can people do to look after themselves? And is it important, if somebody is worried about lung cancer, is it important to do something sooner rather than later?
Yes, absolutely. So if you're worried about lung cancer and you've got any symptoms that you might be concerned about, then what you should do is, as I said earlier, is to make an appointment, either virtual or face-to-face, with your GP and explain your concerns and reasons for concern. And I'm sure they'll be taken seriously, and that they will be investigated, hopefully to exclude lung cancer, but it's important nonetheless. In terms of what can you do to decrease your risk of lung cancer, well, I think the number one is to give up smoking if you are a smoker, and that's not easy, and I think we all recognize that, and there are various ways of being helped, or various sources that can help with that, in terms of smoking cessation clinics or nicotine replacement therapy. And again, if you go to see your GP or the practice nurse at your GP, they can suggest smoking cessation services which are local to you and may be helpful to you. Beyond that, I think just having an active, healthy lifestyle is something which everyone should try to follow, and will decrease your risk of lung cancer.